Welcome to Hacking Health, the podcast for future-focused health experts, thought leaders, and change makers who are passionate about making health accessible for everyone. I'm your host, Sarah Bartholomeusz, and in this podcast, we'll be diving deep into the world of health tech, exploring the latest innovations, sharing stories, and discussing challenges and opportunities that lie ahead, specifically in Australia. Our mission is to empower our listeners with knowledge and insights that will help them drive change and make a positive impact on the health system, because together we can get to the future faster. My guest today is Anoushka Gungadin. She's the CEO and Managing Director of HeraMED, a company dedicated to improving maternal health equity and access to quality prenatal care for expectant mothers across the globe through innovative technology solutions. With a focus on digitalising the pregnancy care experience, HeraMED is transforming how prenatal care is delivered, aiming to foster healthier pregnancies and better outcomes. Originally from Mauritius, Anoushka has 20 years career experience across Asia, Europe, Africa, and Australia as a highly regarded international keynote speaker, author, mentor, and non-executive director for several organisations, including Alleviate. She also serves on the Council for Deakin University, contributing her expertise in strategic leadership and digital health transformation. I'm really interested to hear what inspired you to shift from doing a bachelor's degree in economics to now running a health tech company that's focused on maternal care.
Well, it's not a direct line, Sarah. It took a few detours and roundabouts, and I got myself here. I think if you look at my career, it's been in diverse industry at different roles as well. After finishing my degree, I was offered a job with Mauritius. I was living in Mauritius with the Department of, I guess it was Economic Development or something like that, to be an economist. And I did not take that job. I instead went in corporate. I started working with L'Oreal doing marketing and sales. And after that, then I went to China for about a month. And that was in 2001. And that was the year Beijing was bidding for the Olympics. And they won the Olympics. So I decided to stay. And there I worked for a French law firm, setting up finance and clients account for our Beijing, Shanghai, and Hong Kong office. And then there were teams that were leading those. And fast forward another 10 years, I moved to Australia, where I was doing some consulting work. And also then I started as CEO of the Duke of Edinburgh's Award here in Victoria. I was the founding CEO of the Australia-India Chamber of Commerce pre-COVID. And, through people knowing me, conversations and interest, I am doing what I'm doing now at HeraMED. So really, there's three things that needs to happen for me to make a decision whether at this stage of my life, certainly, it has to have a people, a tech, and an impact component. And the impact is really around either education or health. I believe if we change that, especially for women, we're really impacting multiple generations. So I am on the Council of Deakin University, and I'm heading up HeraMED in maternity and pregnancy care. We are a ASX-listed company. And I think, through my journey, it's also good to see that there's not one direct, straightforward road to where you want to be. And I think for me, taking a punt and doing things that I have never done before has been a bit something I've done throughout my career.
Yeah, but you bring everything that you've learned before into that. So you just mentioned that you've lived and worked in various countries. What is one place that has left a lasting impression on you?
For different reasons, wherever I've been has been important. I lived and I grew up in Mauritius, so that's always home. And going to China for 1 month and then staying there for 10 years, moved to Australia with an Aussie husband. My ex-husband is Australian, and our 2 kids. That was a very big part of my young adult life. I've got friends that have made there that are friends forever. Most of us caught up earlier this year in New York for my birthday, and they will be there forever. So that's a very, very important part with my children and me as a young adult there. And becoming a mum, and I guess in my career as well, it was a big, big time. And then coming to Australia for the last 10 years, I live here. My career here has been very, very interesting. My personal life has been, I went through a separation. It's not been easy. There's been many different hardship. However, it's also been very rewarding. There's been a lot of opportunities. My partner, I met him here, and together we have 4 kids. And, so I think probably it's not the one place, it's probably the people I have met in those different places that I have carried with me throughout that makes it very, very special.
Yeah, I'm sure that is true for many people too. Well, let's get into it because we haven't talked much about the HeraCARE app and how it's revolutionising prenatal care for expectant mothers, and not just here in Australia, but around the world. So what unique features does it offer?
Yeah, so when you look at the model of care for maternity and pregnancy, it has not really changed for 100 years. So the way you and I would have had our antenatal visits was the same our great-grandma would have had, if they were going and getting a scan or seeing a doctor, the measurements and so on. But so it was very much a hospital-centric model. At HeraMED, we're taking a mom-centric approach. And in that, it's really redefining that relationship between the care provider and the moms. So in that sense, there's a lot of empowerment for mom, education. We are educated. We've got a phone. We've got busy lives. So it's really looking at all of that. At the same time, you look at the care provider side. We know there's a shortage of staff. A lot of hospitals are closing. Especially in maternity, you see that. And we, in Australia, for example, we still live in a very large country. Sometimes you do have to travel hours to get somewhere. So looking at all of that, HeraCARE app allows care to continue to happen in between face-to-face visits. We have customized care plans for different pregnancy conditions. So someone with a low-risk pregnancy will have a very different care plan customized to her needs, what she needs to measure, what are the measurements that are actually normal for her. All of that goes into the care plan creation. And then we monitor and manage that. The care provider are able to see if any measurement is out of range, then there is an escalation of care. Let's say we look at hypertension. If blood pressure is high, maybe the next step would be, rest and come back in 20 minutes and take it again. And if that doesn't happen, it could be medication is increased or decreased by their care provider, and then it's monitored. And, at some point they will make a call, go to the hospital or come to see us at the clinic. So that's happening almost in real time. Mum sees it on her app and the care team are able to monitor that. And we have got a number of care plans to cater for low-risk pregnancy, but also chronic hypertension, gestational diabetes, and mental health. And that's postpartum as well, not just during. And we know suicide is very high in terms of what happens in the postpartum, especially after 6 to 9 months, and we can prevent those. So HeraCARE provides those customized care plan. There's care supervision, and there's in between visits that continuity of care. We also have educational content that is delivered based on their care plan. So a low risk mom will have different information than a mom with gestational diabetes, and that's information that we have through our partnership with Mayo Clinic that is delivered and customized. So you can see it's really empowering mom in many aspects of her journey. And also pregnancy is a family event. So someone may be able to join. We have full video conferencing capabilities within the platform. So you could be doing it remotely in an office. I mean, law firm, I've been there, you've been there, you know how, half an hour in an office would be easier than half a day travel back and forth to do a visit, especially if it's low risk. And you could also have your partner join. So there's different ways of, that where it is really bringing convenience at the same level of medical care and safety.
So for me, I probably would have started out low risk, but then developed gestational diabetes, and so the the app can kind of respond to those changes in terms of being low risk, maybe in the beginning, and then there's pathways, I suppose.
Yeah. Yeah, 100%. So this is again what your doctor would have told you without the care app is the same protocol we continue to have. So for you, you wouldn't have noticed anything different, but you would have been moved from a low risk care plan
Okay.
to a plan for gestational diabetes with, your fasting, your measurement, your glucose monitoring happening. And that's because of what they would have detected, before they trigger that you need to go to the next care plan. So that happens seamlessly. The data continues to be collected, and mom have their own data. So, you could go, if you're traveling, you're somewhere, you can have all of that information ready, history of your pregnancy. So it's very convenient in that sense.
Yes.
And as a user of the experience, you wouldn't know that you've been moved.
Okay.
Seamless for you.
So your care providers help with that journey mapping, I suppose. Is that how it works?
It's slightly different in the sense that we create the care journey that they already have. We just bring that enables that to now be done differently.
And so would I work with my doctor together with the app? Yeah. So it would be a doctor that would suggest it to me.
Yeah,
yes.
It's provided through your care provider. So it could be a hospital, it could be a GP clinic, it could be an OBGYN clinic. In some cases, it could be a midwife-led practice. So it's always through a care provider. This is an extension of what you would have if you were to go in their clinics.
In your view, what are the key barriers making health tech like the solutions provided by HeraMED more accessible to populations? How do we ensure equity in digital health advancements, especially like you're saying, we have a huge country, but we do have people who live rurally and who might not have the same access to healthcare?
And the future of health is at home. We want people to be able to stay out of hospital for as long as they need. And we know, even you look at pregnancy, a lot of people show up at the hospital to get reassurance, to have something checked, to get their blood pressure. For example, all of that can be done remotely. So when you look at the future of health, being at home, a lot with patient empowerment, not just in pregnancy, but overall. So that's where we're going. Our reimbursement models, our regulation, our compliance still is what was created around the hospital-centric model. So we do need those to change. We do need that to move. So we need reimbursement to be following, or at least be aligned to the future of healthcare. We do need the regulation as well. When you talk about gold standard, often gold standard in care is based on previous practice. And I'm not saying they are bad or they are wrong. However, if we are moving into a different space, we do need all of that to come together. Some of it is around our profile, our risk, comfort with risk. I mean, we are dealing with people's life. So I totally understand we have to be extremely careful. But in some cases, and I was at one conference and we were debating on that, what is the ethic of having a care solution today, but we're not providing it or making it accessible just because there's some discomfort or we haven't quite worked out the new regulation that you feel comfortable with. What happens to that? Solutions that exist already today, but it is not the traditional one. And so I think we do need the ecosystem to come together.
Yes.
Government, providers, health insurance companies, and tech companies like ourselves to work together and really redefining that. In terms of another layer around equity and access, we've got a large hospital in the US, Broward Health, and they are a safety net hospital. We have rolled out HeraCARE, and in the last 3 months, there's been a number of care plans, but we've also look at different languages. They have big population that speak Spanish, and Haitian, French Creole. So I think these are the kind of things we can do internally with our partners when it's relevant, it's what they need. So in terms of our approach, taking that customer first approach, those are the insights that we bring in. And then we are customizing, innovating within our product and our platform to remove some of those barriers, but they would be different for different places.
Yeah, and I feel like these are fantastic questions to be kind of having publicly, because what your career sort of reflects is, I think, you can correct me if I'm wrong, but you've always gone into spaces where you see there needs to be change to improve situations for people. And this is just like the next iteration of that.
In some ways, that is definite truth to that. You look at, I do a fair bit of speaking around the topic of cultural intelligence and inclusive workplaces, and that's really, and I started that 6-7 years ago when no one was talking about it, and it was well received, but we were not doing anything. And today, when you look at 50% of the population in Australia having at least one parent born overseas, we speak more than 3 languages, yet the apex in corporate and boards is still very homogeneous. And even here, you look at pregnancy, every culture, the way they do pregnancy and delivery is very different. So that is very, very important in how we bring maternity care into different countries, communities. There's definite relevance to that, and we need so we enable care to be delivered. We don't dictate it. So we really take the protocol from the medical team. But, I think cultural relevance in delivery of care is really, really critical for it to be successful.
Yeah, definitely. This is a health tech podcast. And one of the questions I'm interested in is, with the growing use of data and AI in healthcare, how does HeraMED use these tools in improving pregnancy outcomes?
So already we are collecting hypertension data. We're collecting a lot of measurement. Our HeraCARE platform is device agnostic, so we can connect to Bluetooth devices, fetal heart rate, blood pressure, glucose monitoring, as well as surveys for depression, for social determinants of health. And we can, keep adding to that. So we're collecting a lot of medical as well as lifestyle data. And, we know in terms, you talk about access and equity of care, where you live, your postcode, certainly in the US, makes a very big difference in what care you can expect to have, your best case or your worst case. And sometimes a 2-hour travel between one zip code to another can mean a very, very different access to care. So being able to collect all of that and then add that to your clinical data. And then we have partnerships now we've signed a partnership with UTS, University of Technology Sydney, a 5-year partnership to really look at the models of care for the well-being of mothers and babies. Women's health has not been researched, has not been funded, certainly not served enough. So we're doing our bit in really collecting that. I'm very lucky. My chief medical officer is also done, and is one of his areas of passion and expertise is around data and analytics. So we are working closely with our partners around that. So not only are we collecting that, but what do we do? Today we have descriptive analytics. AI and large language models are changing. So layering that, can we then predict well ahead of time, not about the mom herself perhaps, but looking at the trends and even before someone, like in your case, you move from low risk to gestational diabetes. Could there be other data around you, whether it's your eating habits or your mom, or are there other things that could have come in play that could maybe prevented? Or now if you've
Yeah.
had that in the first pregnancy, what about the second? What are we going to do differently? And I think it's just giving those tools. So certainly that as an asset is a big part of our business.
Yes.
And so collecting the what you put in is also what you're going to get out. So we're
Yes.
very mindful of what we're
Yeah.
collecting, and partnerships with both our research partners, academia, as well as hospitals and clinics. Bringing all of that together, we see that as it will be a major step into the future of
Yeah,
health.
fantastic. Is there a particular success story from HeraMED that stayed with you? Perhaps a moment when you realised the true impact of the work you're doing?
Look, to be in health is not easy. As you know, health in moving into digital is one of the industries that is taking a long time. And when we're changing behaviors, which is what we're doing here,
Yes.
again, change is not easy. But then every time we get a story about a mum where we have been able to detect preeclampsia, or even in postpartum care, or a decision has been made for maybe a baby to be delivered, in the next hour or 24 hours, as opposed to having to wait a week for a visit, all of that give us a lot of, warmth to keep going and doing what we're doing. One recent event, I was in Florida in August, and I was at Broward and visited them, and one of the mums was getting onboarded on her HeraCARE plan. She didn't speak much English, but she spoke French and Creole from Haiti. Being from Mauritius, we speak Creole. It's different. However, it was pretty close. So we had a good chat. She was onboarded. I was able to, sit and talk through what was going on with her while she was getting onboarded on the app. And that was really fantastic. I never would have thought I'd go to Florida to speak Creole to, a HeraCARE mom. So that was really very special.
Yeah, that's
And as I said, the Broward serves an underserved population. So sometimes these are the difference between having care or not having care. So, it's really very rewarding to be able to do that.
Especially the cost of healthcare in the United States is, different.
Yeah.
Different again. What advice would you give to young women aspiring to lead in health and tech? How can organisations better support and empower women to rise up into leadership roles?
I would say to the young women, what you feel you want to do, go for it. What worked for me was surrounding myself with mentors, as well as having a team and really understanding what their skill, what their strength was. So, and also knowing my strength. So really going and doing what I do well, continue to do that. And what I don't know or can't know or not interested to know, let others do that, because that's somebody else's strength. So really feel, okay, you need to know what you're good at. Then you don't need to be good at everything. So I think that's an important part.
Yes.
And if you ask for mentors, people generally help.
Yes.
And, I've had most of my mentors in Australia have been male, and they've opened doors. And so I think also removing some of this internal bias that we have. If you feel you belong, you belong. If you don't feel you belong, you will never belong. So remove that, do yourself a favor. In terms of businesses, what we can do on that side, certainly having more female at the leadership table will create pipeline for others to come in. But I do also believe we need to change the workplace for women to be able to have that career. You would know, being in working in law, when you are going to be made partner is probably the same time you're choosing maybe to start a family. That 30-ish, and that's where it's all happening. So do I have a baby or do I miss out on making partner? And we should change some of that, because why should it be an either or? Why can't it be an and? You look at, like all the talk we're doing around menopause, that's not for the young women, but, certainly in the career when your children are a bit older, my age, and that's a big topic that's being talked about, and it has a huge health impact. So I do think a lot has to change from corporate level. It's just not enough to say, okay, we're going to have X number of women and that's how we do it. We got to look at what works as well.
Yeah, the systemic issues. Yeah.
Go for it. I mean, don't let anything stop you.
Yes.
I've done it. Someone else can do it.
Yeah. Love that. Thank you so much for making the time to chat to me today.
Pleasure. Thank you for having me.
Join us for the next episode where we'll be joined by another health tech expert. And don't forget to join the conversation in our private Facebook group, You Legal for Doctors.